Hi, this is Dr. Jamalette Alegria. I am your friendly board certified pediatrician trying to get your child well from the inside out. I am wanting to talk today about something really important. Do you know a child who has had the sudden onset of really unusual symptoms? Things like sudden onset of severe anxiety, like not wanting to go to school all of a sudden, not wanting to be separated from mom or dad. All of a sudden, this is a child that before was fine separating, was fine going and being away, but all of a sudden is really, really freaked out about being away from the mom or from the dad or from some other loved one. Or maybe it's a sudden onset of significant OCD. Now, we often think about OCD as like hand washing or touching the doorknob a couple of times or 3 or 4 times, but OCD is really intrusive thoughts. It can be intrusive ideas. It can be persistent asking, like asking the same thing over and over and over, or requiring that somebody does something a certain way for them. Bedtimes with intricate routines around meal times, or even refusing to eat, because especially if it doesn't look the right way or if the foods are touching a certain way. So OCD can present in lots of different ways in children. And maybe from one day to the next, a child has had a sudden onset of those symptoms. Or do you know a child who has had the sudden onset of a movement that is unusual, like a tic, like an eye blinking tic, or a head movement tic, or a shoulder shrugging tic? All of those things are really unusual to just come and spring on all of a sudden, and it could be something called PANDAS. PANDAS is a disease that has been described for almost 30 years in the literature, but it's still a pretty controversial disease. People out there in the medical community still may sometimes not even think that it really exists, that it is a thing. What it stands for, it's not the cute little animal that you can go see in the zoo. What it stands for is pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. So this disease occurs when strep, the same strep that can cause strep throat that you have probably had once or twice or even more in your life, that same strep bacteria can trigger this neuropsychiatric disorder in a child's brain. And that child can have these sudden life-changing symptoms that I just described: OCD, severe separation anxiety, severe anxiety in general, tics, motor tics. It can also come along with pretty significant personality changes, very big mood changes, significant tantrums. These are 7, 8, 9-year-old kids that are screaming and crying and throwing things and using language that you would never expect out of a child like this. So sudden personality and mood changes. And it can also come along with sudden sensory changes, like all of a sudden not wanting to wear socks or not wanting to wear pants that don't have a certain kind of elastic band. I have even heard of kids that suddenly don't want to wear any clothes, and so parents just can't leave the house because they can't get the child to put any clothing on, or it's a huge struggle to get them to get dressed. So sensory issues, very sensitivity to loud noises, and again, these are all a change. So there are kids that have sensory processing problems from a young age. There are kids that may have separation anxiety that came on really early on, and it's something that they've struggled with. But kids that have been neurotypical, meaning developing perfectly normally, maybe have a quirk here and there, but otherwise developing perfectly normally, suddenly having some of these symptoms, and it can be from one moment to the next, from one day to the next. This is something real. and it is something that I have seen in, at this point, over hundreds of patients that have come through with parents that are desperate, wanting to know, is this PANDAS? Does their child have PANDAS? Now, PANDAS is a disease that is a post-infectious inflammatory process, and PANDAS as a disease is strictly due to strep. So there has to be a strep infection associated with the onset of the symptoms. Now, the most typical presentation is you have a child that develops a strep infection, maybe has a fever, maybe doesn't have the typical strep symptoms that you would think of, like the sore throat, and the headache and the high fever. Some kids with PANDAS especially just don't get the fever, and we don't have a great explanation why, and they don't often get the sore throat. So they can have a strep infection that maybe presents as headache or abdominal pain, maybe a fever, maybe not, and then within a day or two, or even 3 weeks, 6 weeks, 6 months of that infection, have a sudden onset or sudden change in their symptoms. And these are the things that I described at the beginning of this video. So sudden onset of anxiety, OCD, tics. Sometimes it can be a little bit gradual, like the tics started happening and then the OCD started happening and then the separation anxiety started happening. I have seen that. But the typical presentation is a child has had a strep infection. That strep infection is proven by culture, treated with antibiotics maybe for the normal 10-day course, does okay during that period of time of treatment, stops the antibiotics as instructed because that's what we do. We only treat for a certain amount of time when we're treating strep, and then maybe within the next week or 2 weeks starts to have these symptoms. So I have had patients brought to me when they are at the very beginning of this, within a week or even within 2 weeks of developing these symptoms. And we are usually able to confirm the diagnosis of PANDAS just based on the criteria that we have to diagnose it. Really, the clinical criteria for PANDAS diagnosis is very simple. Presence of significant obsessions, compulsions, or tics, abrupt onset of symptoms, or it can be a relapsing remitting course, meaning that you have an abrupt onset of symptoms that are significant, and maybe over time, even without treatment, those symptoms start to wane and things start to get a little bit better, and then you start to maybe not even notice those symptoms, but then the child gets sick again a few months later and then the symptoms come back. That's relapsing remitting, so something that just comes and goes and comes and goes. So even without it being the first sudden onset of the symptoms, you can make the clinical diagnosis based on that kind of history. PANDAS, technically, the first onset of symptoms has to be before puberty. So if you have a child that has never had any sort of symptoms at all and is coming to you in their teenage years with a sudden onset of symptoms, it's not to say that it's not a post-infectious neuropsychiatric syndrome, because there is more out there than just PANDAS, but it's most likely not PANDAS alone based on the clinical criteria that have been described in the literature. It has to be associated with a streptococcal infection. So in general, the best way to know this is by doing a strep culture of the throat. But do keep in mind that we can have strep living in different parts of our bodies, not just the throat. So a nasal culture, strep loves to live in the nasal passages, and even a rectal culture. You can have perirectal strep. Children have this, and sometimes that's their trigger. And so there was never a sore throat. There was never anything obvious to make somebody think of strep, but maybe they had some redness around in their anal area, and that could be a perirectal or perianal strep, and that could be the trigger. So you want to culture all 3 of those sites and make sure that somebody's really looking for strep in all 3 of those sites. A lot of us do check labs on patients who come in where we suspect strep. or suspect PANDAS, and so there are titers that you can check in the blood to see if strep is present or if there are strep antibodies for the child. But technically, that's not part of the criteria. So you can have negative strep titers and still have PANDAS. You can have negative strep titers and have full-blown rheumatic fever. It's totally possible. So while when they're there, it can be somewhat helpful to give us an idea that strep is part of the picture. It doesn't necessarily mean if they're negative that there isn't any PANDAS. And then really it can be, the other criteria is association with other neuropsychiatric symptoms. Overall symptoms of things like restrictive eating, children that will suddenly refuse to eat because either they think that you are poisoning them, they are afraid of contamination, so it could go in with their intrusive thoughts, unrealistic fears and anxieties. Sometimes they restrict their eating for other reasons too. They just may not want to eat, they may not have an appetite. A lot of times though, it's due to an anxiety or a fear. A lot of children come to me with PANDAS who have a significant fear of vomiting or a fear of choking, and so that may be why they're restricting their eating. We talked about the tics. The emotional lability, that's a really big one. That's one where you can have a child that's okay, and these parents will come and say, I don't know what's going to trigger my child. We could be perfectly fine. I could ask him to put his socks on so we can get ready for school, and it can be a full-blown meltdown over putting socks on, and it can last 2 hours. So this emotional lability is really big. Irritability and aggression. Children that are hitting, punching, fighting, kicking, biting, things that are just unheard of for a child who's neurotypical and developmentally normal, 7, 8, even 10 years old. It is really, really concerning to families. Other children in the home can get scared. So it's a really big part of the disease. Not all children do all of these pieces, but these symptoms can be present. And if you know a child who is doing this and it's out of character completely for them, really think about PANDAS and really think about looking for somebody who can help you get that diagnosed and treated. Another really big change is a change in school performance, especially math and especially handwriting. There can be a deterioration in their handwriting. There can be a deterioration in their ability to do math, their attention, and their focus. And so this is really a big deal because a lot of times these kids were doing great in school or doing fine in school, and now all of a sudden they're having a lot of trouble or really having trouble focusing and sitting still. So that's a really big problem and one of the things that parents will bring to me. So I've just talked a lot about some of the things that somebody can have when they present with PANDAS. So the most typical symptoms are sudden onset of tics, motor tics, vocal tics, throat clearing, coughing, movements, and a sudden onset of OCD, which in kids can look really different than what you would expect in adults. So there can be fear of contamination. There can be fear of not being able to get to the bathroom. And so these are kids that want to go pee every 2 minutes because they're afraid that they're not going to be able to go to the bathroom. There can be just a lot of reassurance needing. So, Mom, I just had this thought. Is that okay? Mom, I just touched this this piece of toast. Is that okay? And just constant need for reassurance and constant question asking, ritualistic behavior, needing to have things done a certain way. For a child who's never had these things, sudden onset of these symptoms is absolutely unusual and absolutely something that needs to get checked out. And so between the tics and the OCD and then some of the other behavioral things that we talked about, if you know someone who has any of those symptoms, I urge you to have them see a physician who's open to the idea of PANDAS, who knows about the diagnosis of PANDAS, and is willing to, if not able to get it treated and taken care of him or herself, get you referred to somebody who can. Because it is a thing, it is real. There are treatments out there. We have helped so many kids go from a state of just being in fight or flight, fear, anxiety, debilitating tics, debilitating OCD, to living normal lives and being back to themselves. Parents on the phone telling me, I have my child back. He's back. I can see him. He's there. And you know, it's not always 100% all the time. It doesn't happen from one day to the next that the improvement is sudden and amazing, but it's gradual. We see kids having more good days than bad days, and then having even more good days than bad days. And eventually getting to a point where they're back to who they are and their normal selves. So there's hope. If you know somebody or your own child has had struggles like these, definitely reach out and look for a physician who can help get him or her diagnosed and get him or her treated and get him or her back on the road to recovery and whole self perfect wellness. If you have any questions, please shoot them down in the comments or questions section, and I would love to be able to try to answer them. If you know somebody who could use some support in this area for PANS or PANDAS, definitely send them this video link. Tag them below in the comments, and just make sure that this gets out there, because I think that it's just something that people don't talk about enough. And it's something that's real, and I've become really, really passionate about it because I've seen lives changed over getting the proper diagnosis and the proper treatment. So until next time, I hope everybody has a wonderful day, and I hope that everybody is one step closer to vibrant health. Take care.